Hey, Journey Fit fam, it's Cindy. Well, getting a little work done on me right now. I got my friend Chris Capilli back here. He's a physical therapist. If you guys have been here and listening to the announcements, you'll know that he will be here on September 7th. He's going to be talking to you about recovery and stretching and different things that physical therapists do to help, whether you're an athlete or whether you just work out all the time or you have aches and pains or whatever your needs are. Well, I have a little bit of an issue with my foot, and probably some of you have noticed I've had some tape on there for a couple weeks, and well, I've had the tape off because I was on vacation and probably wore some shoes I shouldn't have been wearing, some flip-flops Chris told me not to wear that I did, and told me to ice it, which I haven't been. So Chris came to see me tonight I know, you're shaking your heads right now. Chris came to see me tonight at Journey Fitness because he is willing to do that, which I certainly appreciate, that is for sure. And he's come many times to see me here at Journey Fitness, and he would do that for you as well. So, Chris,
yes.
What I have going on, is this something common? Is there other common things you may see with people? Tell them a little bit about what we got going on here.
This is very common. When you're doing a lot of exercise, a lot of ballistic or jumping movements, it's very easy for the muscle to break down. Okay, and when that breaks down, what your body does, your body is very smart. It wants to get from point A to point B and continue exercising and continue to move on. The negative is that we start to compensate, and by compensating, we start to wear and tear muscles that aren't used to taking that kind of load. So what I'm doing here with Cindy is she has a little bit of Achilles tendonitis, a little bit of plantar fascia, and it's just been affecting her foot and ankle. So anytime that she's walking on surfaces that are either flat, wearing poor shoes, or she's walking on flat surfaces, or just jumping and showing you guys how to do your exercises, it's constantly irritating it. This has been going on for a while, and by compensating, it starts to move up the chain. That's why if something like this happens, it's very important to talk to Cindy and Travis about how you can adapt the exercise and maybe make it a little bit more easier for you, less straining. But in terms of physical therapy, the sooner you can see us, the better, because after this presents itself, it may actually be starting from the hip and lower back. Okay, so if you have a proximal or a hip issue and a low back issue, it may not present itself until later down the line, where now Cindy's like, oh, my foot's bothering me. Well, let me look at everything else and see if there's any other weaknesses, which we found. And Cindy has exercises for it, which she is doing faithfully. So I'm looking forward to meeting everyone on September 7th. Come on out. We'll talk a bit more in detail about it. And I will be around also to see if need be.
What are some of the other top 3 or 5 most common things you treat people for?
That's a loaded question.
Is it?
It is. I do see a lot of foot, ankle, a lot of shoulder injuries, low back issues also, but it also comes down to compensating. When you're working your shoulders out and you're doing an exercise, you're not in a proper position and proper form to be able to produce the contraction and the results that you want. Like I said, breaking down muscle that's not used to doing that certain function. So you're putting, we always say in our field, you're putting abnormal stress on normal tissue. So you're putting abnormal forces on a muscle that's not used to doing that, and it's can only do it for so long. We say if you're working a job and a coworker takes a week off, and then the coworker doesn't come back, and the boss says, hey, you have to do both jobs. You can only do that for so long, right? Until something breaks down, something happens, and you need help.
Okay. And you're using some different tools here. Boy, these tools are...
This is a form, it's called IASTM. It stands for Instrument Assisted Soft Tissue Mobilization. And there's a number of different tools out. These are actually the tools that I prefer. These are the leader in the field now. They're called hawk grips. And you can span over here and see we have a number of different instruments here, different shapes and sizes, different contours. I know they look like medieval torture tools here, but with Cindy here, we're using these for instruments, and the concept behind this, using the tools, is that I can actually get deeper in her, through her skin, through her muscles, than I can with my fingers. So once the fat pads of my fingers touch her skin and I try to get a certain depth, it creates a barrier or a resistance. Okay, these are stainless steel, and these can get a little deeper than I can. Okay, what I'm looking for here is restrictions within the tissue. And actually, if you can get closer, Travis, you can see the skin. See the skin kind of dimple there a little bit? What that is actually the muscle fibers are sticking to themselves. It's getting dehydrated, and we really need to use the tools to get in there and iron it out.
So this is this muscle fascia that we've been talking so much about, yes?
Yes.
Okay.
Yep.
All right. Very cool. Very cool. And let me just ask you this for our members, since we are a fitness, nutrition, and coaching type of facility, how much for the things, how much would it help the things you see for people to exercise more regularly, sometimes lose some weight, eat properly? That's 80% of weight loss.
Absolutely. That all plays a role. Staying flexible. There's actually
stretching.
If you go on Google and look up the fuzz speech, it talks about fascia and soft tissue and how it's so important to in the morning, throughout the day, to allow your muscles to move and to glide, because you have fluid that needs to assist in movement. And if that doesn't occur, you're going to have restrictions like we just saw, that I just went over with the instrument. So using all those, the flexibility, the weight loss, nutrition, of course, is a huge component. So having that all in your back pocket will definitely benefit you in your health.
Awesome. Thank you so much for being here.
Thank you.